We studied Pembrolizumab and Vorinostat in patients with relapsed refractory classical Hodgkin lymphoma, and we enrolled 32 patients. The bulk of them actually had been exposed to prior PD-1 blockade, and 18 of them were actually refractory to prior PD-1 blockade. And what we showed is that the response rate and complete response rate were quite good overall in the study, but particularly in the group of patients who were refractory to prior PD-1 blockade, more than 60% of patients responded to Pembrolizumab with Vorinostat, and there were a couple of patients who actually had complete responses. And so we've actually found that 12 of the patients out of the 18 were receiving PD-1 blockade and progressing on PD-1 blockade as their most recent therapy, and 8 of them responded. So I think it was a proof of concept that we can use epigenetic modifying agents like HDAC inhibitors to potentially resensitize patients with Hodgkin lymphoma to PD-1 blockade even after they progressed, and kind of allow us to use those, the well-tolerated immunotherapies kind of for longer, and kind of recapture responses when we add one of these other agents.